Gum tissue grafts come in two forms. First of all, we can use the patient's own gum, which will allow us to take some gum from the palate, which is a good, thick, hard tissue. And it also has the genetic code to change the tissue wherever you place the graft. So it changes any tissue that you place it, the same quality of tissue you have in the palate. You'll use it wherever there is, for example, gum recession around teeth, where the root surface is a bit exposed. Rather than putting a filling on it, we prefer to put a gum graft on it. And also, it will be useful where the gum has thinned over time, where teeth have been lost. So we're talking about bone grafting, but you also need adequate soft tissue thickness over the bone graft to be able to successfully cover a bone graft so it can be healed properly. So the tissue that we take from the palate, or we can also use proprietary collagen from animals that have been processed in a certain way to bulk out the tissue and to cover areas that have been previously exposed by disease. It depends. I mean, the surgery itself is, an hour or two, but the healing time needs to be a little bit prolonged. So we are looking really at least at 8 to 12 weeks of soft tissue healing before it becomes anywhere near mature enough for you to be able to brush and clean properly. And during that time, you have to be very careful with it. You have to not scrub it with a brush. You have to be careful not to traumatize it. And it just takes time for that tissue to mature into something that will be into future function. But it's very predictable. If you get it right, then you can actually augment quite large areas of tissue. And the nice thing about the palate is that the palatal tissue will then regenerate. And if you need to go back in a few months later, a year later, you can take more tissue from the palate and it will just keep regenerating and giving you as much as you require for different areas. If it's required, it's suitable for you, and because very often we use your own tissue, then there is no problem with using a different product. There is some soreness in two sites, of course, the surgery site and the donor site in the palate. But once they heal, they work very nicely. If we are using very large areas or over bone grafts, then using proprietary collagen, which can come in bigger sheets, is a better idea, and obviously stops you from requiring your own tissue being harvested from the palate. But for some areas, the palate tissue is better, and it depends on the individual and the site that we're treating as to which we use and we'll advise accordingly. It's very effective. If you have lost tissue, replacing it with your own tissue or a graft is very effective, and you will get extra volume, you'll get stability, you'll get better appearance, and you'll get the tissue, the nature of the tissue will change so that it's tougher and more resistant to future recession. The downsides are, of course, that because you are relying on a piece of tissue that you're taking from somewhere and putting somewhere else, that tissue has to regenerate its own blood supply. It has to develop its own blood supply. And if the surgery is unsuccessful, you can lose the tissue. So if it begins traumatized or if it doesn't work, then you can actually end up with a result that's slightly worse than what you started off with. And again, it depends on the site as to how severe this might be. But we'll tell the patient what the risks are. But on the whole, 95% of cases you'll get additional tissue, and it will become more stable over time, and it works immediately. Something that if it's something you can't do without, you use it quite routinely. It's like any surgery. I mean, most surgery in the mouth will all surgeries heal at the same rate. So regardless of the scope of surgery, even if it's one site or a full mouth, the speed of recovery is actually the same, because all of the tissues are healing at the same time, at the same rate, in a certain way. You can't really speed it up, and there are certain medical conditions that will slow it down. So, for example, if you're a smoker or you're a diabetic or you have reduced vascularity in the area, then they will compromise the result. And in some cases, we would actually advise the patient that it's probably not worth doing because the rate of success is much lower in these cases. But if you're a healthy patient with a good blood supply and everything heals normally, then everything heals regardless of the size of the site. And usually there'll be about a week of discomfort. We take sutures out normally in about 2 weeks, but it takes about 6 to 8 weeks for the tissue to mature enough for it to feel comfortable enough to brush properly. And the longer you leave it, the better it gets. And when you look at gum grafts 2, 3, 4, 5 years down the line, you find that the tissue actually gets even better with time. Change the genetic underlying code for the tissue. That means the new tissue that's regenerated over time as your body turns over is actually a better quality than you had at the start. So it's a long-term benefit. It's not just a short-term benefit. It actually improves with time and matures with time.